Now, let's get to the why. The sources make some pretty big claims about China's advantages, especially on quality, cost, and speed. Let's start with cost. That's usually a huge driver for medical travel.
Yeah, the cost advantage is probably the most consistent point across all these sources, actually. China's healthcare costs are cited as being, well, substantially lower than in Western countries.
Substantially lower, like how much? I think one source said a fraction of the cost.
Yeah, and another gave a range something like 30% to 70% lower than in the United States or Western Europe.
Wow, 30 to 70%. That's a massive potential difference.
It really is. And they give examples, like a knee replacement. Might cost you, say, $40,000 in the U.S. The source is cited around $15,000 in China.
Okay, so that's like what, over 60% cheaper potentially?
Exactly, a really concrete example of that saving.
And there was that cost comparison table in one source, right, showing different procedures.
It listed things like heart bypass around $10,500, hip replacement maybe $10,000, dental implant $1,500, breast implants $3,500.
And how did those compare to other places?
Generally competitive with, or sometimes even lower than, other Asian spots like India, Thailand, Singapore, and, significantly lower than the U.S. prices listed.
Right, so the potential savings look pretty compelling across a lot of different treatments.
Definitely, from complex surgeries to cosmetic stuff to dental. But, digging a bit deeper, there is some nuance in the sources.
Oh, like what?
Well, one source points out that for aesthetic surgery, the costs might actually be substantially the same as in South Korea.
Ah, okay. So a major competitor in that specific field.
Exactly. And for certain really advanced drugs, like specific targeted cancer therapies or maybe some vaccines, the treatment might actually be cheaper and available sooner, somewhere like Hong Kong, even with travel costs.
That's a really important clarification. So the cost advantage isn't maybe totally universal. It depends on the specific treatment or drug and who you're comparing it to regionally.
Precisely. Significant savings often claimed yes, but with some notable exceptions highlighted.
Okay, so cost is a major claim, but with caveats. What about quality? The sources also talk up high-quality facilities and expertise.
They do. The reports describe China having world-class healthcare facilities, equipped with state-of-the-art technologies.
And staffed by highly skilled medical professionals, right? I think some sources even mention doctors trained in the U.S. and Europe.
Yes, suggesting that global standard of expertise. And critically, the material highlights internationally accredited institutions and hospitals.
Like JCI or ISO accreditation.
Exactly.
So the sources seem to position China's top places as competing not just on price anymore, but really on the quality of care, aiming for that international standard. Let's move on to the third point, speed, waiting times. What do the sources say there?
Well, one claim is that procedures in China have low waiting time.
Okay.
Other information pops up that paints a different picture.
Like the fact that China has the highest population in the world.
Exactly. And that source goes on to say, as a result, most of their hospitals are often busy, making them not very suitable for medical tourism in some cases. Yeah, significant queues exist within the domestic system. And that could potentially affect international patients, too, especially in public facilities. It suggests that maybe low waiting time isn't a guarantee everywhere for every treatment. It likely depends a lot on where you go, maybe private international wings versus general public hospitals. So we've covered the treatments and dug into the claims and nuances around quality, cost, and speed.